Posttraumatic Stress Disorder, PTSD. Understanding PTSD, unraveling the consequences of trauma. Post-traumatic stress disorder, PTSD, formerly known as shell shock or battle fatigue syndrome, is a profound condition that can emerge following exposure to or witnessing a traumatic event involving severe physical harm or threat. PTSD manifests as a lasting repercussion of distressing ordeals, instigating intense feelings of fear, helplessness, or horror. Incidents such as sexual or physical assault, sudden loss of a loved one, accidents, warfare, or natural disasters can serve as triggers for PTSD. Notably, not only direct victims but also families, emergency personnel, and rescue workers may succumb to the debilitating effects of PTSD. While reactions like shock, anger, nervousness, fear, and guilt are common after a traumatic event, they typically subside with time. In contrast, individuals with PTSD experience a prolonged and heightened persistence of these emotions, hindering their ability to resume normal life. The symptoms persist for over a month, significantly impairing their functionality compared to pre-trauma levels. PTSD symptoms unveiled. Symptoms of PTSD typically manifest within 3 months of the traumatic incident, although in some cases, they may delay for years. The severity and duration of the disorder vary widely, with some individuals recovering within 6 months, while others grapple with it for an extended period. The symptoms of PTSD can be broadly categorized into 4 main clusters. Reliving. Individuals grappling with PTSD often find themselves entrapped in a relentless cycle of reliving the traumatic experience. This haunting reoccurrence takes shape through intrusive thoughts, vivid memories, distressing flashbacks, and harrowing nightmares. The mental and emotional turmoil associated with reliving the trauma is exacerbated by specific triggers, such as the anniversary of the event. The haunting echoes of the past infiltrate the present, intensifying emotional distress and hindering the individual's ability to move forward. Avoidance. A hallmark of PTSD, avoidance behaviors are employed as a coping mechanism to shield oneself from the overwhelming memories and emotions tied to the traumatic event. Individuals may consciously or unconsciously avoid people, places, thoughts, or situations that serve as reminders of the trauma. This avoidance can manifest as a profound sense of detachment, isolating the individual from loved ones and fostering a disinterest in activities that were once a source of joy. The pervasive avoidance serves as a protective barrier, albeit one that impedes the healing process and reintegration into daily life. Increased arousal. The cluster of increased arousal encompasses a spectrum of heightened emotional and physiological responses that linger long after the traumatic event. Emotional manifestations include excessive reactivity, difficulties in forming and maintaining interpersonal relationships, sleep disturbances, irritability, anger outbursts, and concentration difficulties. Physiological symptoms manifest as an elevated heart rate, increased blood pressure, rapid breathing, muscle tension, and gastrointestinal distress, including nausea and diarrhea. This heightened state of arousal leaves individuals in a perpetual state of alertness, making it challenging to navigate everyday situations without being overwhelmed by the remnants of trauma. Negative cognitions and mood. The insidious impact of PTSD extends to the realm of thoughts and emotions, encapsulating persistent negativity. Individuals afflicted by PTSD grapple with self-blame, a pervasive sense of estrangement from others, and haunting memories that cast a long shadow over daily life. The cognitive distortions and negative mood states contribute to a distorted perception of the self, others, and the world at large. Over time, these negative cognitions can erode one's sense of self-worth and complicate the process of forging meaningful connections with others. It's noteworthy that young children experiencing PTSD may exhibit developmental delays in areas such as toilet training, motor skills, and language. PTSD causes and risk factors. Individual responses to traumatic events vary, and not everyone exposed to trauma develops PTSD. Factors such as coping mechanisms, support systems, and the nature of the trauma play pivotal roles. Originally identified among war veterans, PTSD can affect anyone exposed to traumatic events, including those who experience childhood abuse or recurrent life-threatening situations. The highest risk for PTSD lies among victims of physical and sexual assault. Additional risk factors include a history of other mental health issues, a family history of mental health problems, or a background of substance abuse. The likelihood of developing PTSD may increase if these risk factors coexist. How common is PTSD? Approximately 3.6% of adult Americans, equating to around 5.2 million people, experience PTSD in a given year. Estimates suggest that 7.8 million Americans will grapple with PTSD at some point in their lives. PTSD can emerge at any age, even in childhood, with women being more susceptible. Potentially due to higher instances of domestic violence, abuse, and rape. Diagnosing PTSD. PTSD diagnosis occurs at least 1 month after the traumatic incident. Medical professionals. After ruling out physical illnesses through a comprehensive history and physical examination. May refer individuals showing PTSD symptoms to mental health specialists. Psychiatrists and psychologists utilize tailored interviews and assessments to diagnose PTSD based on reported symptoms and associated functional impairment lasting more than 1 month. PTSD treatment approaches. The journey toward healing from post-traumatic stress disorder, PTSD, is a multifaceted expedition, with treatment strategies meticulously crafted to address the emotional, physical, and functional dimensions of the disorder. The overarching goals of PTSD treatment revolve around alleviating symptoms, improving daily functioning, and empowering individuals to navigate the impact of the triggering event. Within this framework, treatment modalities encompass a dynamic interplay of psychotherapy, medication, and sometimes a synergistic combination of both. Alleviating emotional and physical symptoms, the core objective. At the heart of PTSD treatment lies the imperative to alleviate the emotional and physical symptoms that weave a complex tapestry of distress in the lives of affected individuals. These symptoms, ranging from intrusive thoughts and nightmares to heightened arousal and emotional reactivity, are the visceral echoes of traumatic experiences. Addressing them is fundamental to restoring emotional equilibrium and fostering a sense of control over one's mental and physical well-being. Psychotherapy, unraveling the emotional threads. Psychotherapy, often regarded as a cornerstone of PTSD treatment, involves a therapeutic alliance between the individual and a mental health professional. Within this supportive framework, various psychotherapeutic approaches come into play, tailored to the unique needs and preferences of each individual. Noteworthy among these approaches are cognitive behavioral therapy, CBT, a systematic approach that aids individuals in recognizing and reshaping maladaptive thought patterns, emotions, and behaviors tied to their traumatic experiences. CBT equips individuals with coping mechanisms to navigate triggers and reframe their perceptions. Prolonged exposure therapy, a behavioral therapy designed to gradually expose individuals to the memories, situations, or thoughts associated with the trauma in a controlled and safe environment. This exposure aids in desensitizing the emotional response, fostering adaptation and resilience. Psychodynamic therapy, focused on exploring the deeper emotional and relational aspects of the trauma. Psychodynamic therapy aims to uncover unconscious processes influencing thoughts and behaviors. By addressing underlying conflicts, individuals can gain insight and pave the way for healing. Desensitization and reprocessing, EMDR, a specialized form of psychotherapy designed to alleviate distress associated with traumatic memories. EMDR involves bilateral stimulation, such as rapid eye movements, to facilitate the reprocessing of traumatic experiences. Medication, balancing the neurochemical landscape. In certain cases, medication is integrated into the treatment plan to manage specific symptoms associated with PTSD. Notable medications include selective serotonin reuptake inhibitors, SSRIs, antidepressants such as citalopram, fluoxetine, and sertraline are commonly prescribed to alleviate symptoms like anxiety and depression. Mood stabilizers, medications like divalproex and lamotrigine may be employed to regulate mood and emotional stability. Atypical antipsychotics, aripiprazole and quetiapine are sometimes utilized to address specific symptoms associated with PTSD. Blood pressure medications, prazosin, clonidine, and propranolol can be prescribed to manage symptoms like nightmares and hyperarousal. Combination approach, maximizing therapeutic synergy. Recognizing the multifaceted nature of PTSD, treatment plans often integrate both psychotherapy and medication to optimize therapeutic outcomes. This combination approach addresses symptoms from various angles, synergistically fostering emotional resilience, cognitive restructuring, and neurochemical balance. Outlook and prevention. Recovery from PTSD is a gradual, ongoing process. While complete elimination of symptoms is rare, treatment significantly reduces their intensity and frequency. Research into the factors influencing PTSD and the development of novel treatments continues. Early intervention following trauma may mitigate some symptoms or prevent PTSD. Timely support from friends, family, and professionals can play a crucial role in shaping the trajectory of PTSD outcomes. FAQ. What is post-traumatic stress disorder, PTSD? Post-traumatic stress disorder, or PTSD, is a serious mental health condition that can develop after exposure to or witnessing a traumatic event involving severe physical harm or threat. Formerly known as shell shock or battle fatigue syndrome, PTSD manifests as persistent and intense feelings of fear, helplessness, or horror. Traumatic events can include sexual or physical assault, sudden loss of a loved one, accidents, warfare, or natural disasters. Who can be affected by PTSD? PTSD can affect anyone who has experienced or witnessed a traumatic event, not limited to direct victims. This includes families, emergency personnel, and rescue workers. Originally identified among war veterans, PTSD can also arise from childhood abuse, recurrent life-threatening situations, or other traumatic experiences. Certain populations, such as victims of physical and sexual assault, are at a higher risk. What are the common symptoms of PTSD? The symptoms of PTSD can be categorized into 4 main clusters: reliving, intrusive thoughts, vivid memories, flashbacks, and nightmares related to the traumatic event; avoidance, conscious or unconscious avoidance of reminders of the trauma, leading to detachment and isolation; increased arousal, heightened emotional and physiological responses, including irritability, sleep disturbances, and heightened startle responses; negative cognitions and mood, persistent negative thoughts, self-blame, estrangement from others, and haunting memories. When do PTSD symptoms typically appear? Symptoms of PTSD usually manifest within 3 months of the traumatic incident, but in some cases, they may be delayed for years. The severity and duration vary, with some individuals recovering within 6 months, while others may grapple with it for an extended period. How is PTSD diagnosed? PTSD is diagnosed at least 1 month after the traumatic incident. Medical professionals, after ruling out physical illnesses, refer individuals with symptoms to mental health specialists. Psychiatrists and psychologists use tailored interviews and assessments to diagnose based on reported symptoms and associated functional impairment lasting more than 1 month. What are the treatment approaches for PTSD? The primary goals of PTSD treatment are to alleviate emotional and physical symptoms, improve daily functioning, and empower individuals to manage the triggering event. Treatment modalities include psychotherapy, such as cognitive behavioral therapy and prolonged exposure therapy, medication, antidepressants, mood stabilizers, atypical antipsychotics, and blood pressure medications, and a combination of both. Can PTSD be completely cured? While complete elimination of symptoms is rare, treatment significantly reduces their intensity and frequency. Recovery from PTSD is a gradual and ongoing process. The goal is to empower individuals with tools and coping mechanisms to effectively navigate the aftermath of trauma. How common is PTSD? Approximately 3.6% of adult Americans, equivalent to around 5.2 million people, experience PTSD in a given year. It's estimated that 7.8 million Americans will grapple with PTSD at some point in their lives. PTSD can emerge at any age, including childhood, and women are more susceptible, possibly due to higher instances of domestic violence, abuse, and rape. Is early intervention helpful in preventing PTSD? Yes, early intervention following trauma may mitigate some symptoms or even prevent the onset of PTSD. Timely support from friends, family, and professionals plays a crucial role in shaping the trajectory of PTSD outcomes. What does the future hold for PTSD research and treatment? Ongoing research continues to explore the factors influencing PTSD and the development of novel treatments. The field is dynamic, aiming to refine understanding and identify innovative approaches to enhance the recovery process. A collective commitment to early intervention, support, and research propels the future of PTSD towards improved outcomes and increased resilience. Conclusion: navigating the path to recovery from PTSD. In the intricate landscape of post-traumatic stress disorder, PTSD, the journey toward healing is both profound and complex. PTSD, born from the crucible of traumatic experiences, casts a long shadow on the lives of those affected. As we delve into the unraveling consequences of trauma, it becomes evident that PTSD is not merely a collection of symptoms, but a profound alteration of one's emotional, physical, and cognitive landscape. The hallmark symptoms of PTSD, from the haunting reliving of traumatic events to the pervasive avoidance and increased arousal, paint a vivid picture of the challenges individuals face. The negative cognitions and mood states weave a tapestry of emotional turmoil that can erode one's sense of self-worth. Notably, the impact extends beyond the individual, affecting families, emergency personnel, and rescue workers who bear witness to the aftermath of trauma. Diagnosing PTSD is a crucial step on the path to recovery, ensuring that individuals receive the tailored support they need. The multifaceted treatment approaches, encompassing psychotherapy, medication, or a synergistic combination, underscore the complexity of addressing the emotional and physical dimensions of the disorder. Alleviating symptoms and empowering individuals to navigate the impact of the triggering event are the core objectives of PTSD treatment. As we peer into the future, ongoing research offers hope for enhanced understanding and innovative treatments. While complete elimination of symptoms remains rare, the gradual reduction in intensity and frequency through treatment signifies a beacon of hope for those on the path to recovery. Early intervention emerges as a powerful tool, mitigating some symptoms and, in certain cases, preventing the onset of PTSD. In this collective endeavor to illuminate the shadows of trauma, the role of friends, family, and professionals cannot be overstated. Timely support becomes a lifeline, shaping the trajectory of PTSD outcomes. As we strive for improved outcomes and increased resilience, the journey continues, an expedition toward a future where the echoes of trauma yield to the triumph of resilience and healing. Your health matters. Quali.health